So I'm going to provide patient privacy by closing the door. I'm going to perform hand hygiene and clean off my stethoscope in view of the patient. So hello, my name is Cassidy and I'm going to be your student nurse today. Today I'm going to be performing a head-to-toe assessment on you. Is that okay?
Mm-hmm.
Okay. So I'm going to start off by asking you a few basic questions. First, can you tell me your name and date of birth?
Cameron Collart, January 26th, 2000.
Okay. Do you know where you are right now?
The hospital.
And do you know approximately what time it is?
3:30.
Okay. Do you have any allergies?
No.
No food allergies, medication allergies?
No.
Okay. And on a scale from 0 to 10, 10 being the worst pain of your life, to 0 being none at all, are you having any pain right now?
Nope.
Okay. My patient is alert and oriented times 3. He's able to tell me his name, where he is, and the approximate time. He states he has no allergies and has no pain, and he appears to be in no apparent distress. His speech is also clear and articulate. He's been able to answer all my questions appropriately. Okay, so next I'm going to move on to assessing the hair and the scalp. Do you have any bumps on your scalp?
I hope not.
Okay, so I'm going to palpate the scalp. I don't feel any bumps. The hair has a normal distribution. It feels very healthy. It doesn't feel dry or brittle. I don't see any balding. I'm going to check for any lesions or infestations. I don't see anything present. Everything appears to be normal. Next, I'm going to move on to inspecting the face and the neck. Face and neck appear to be symmetrical. I'm going to check the temperature of the skin. Skin is warm and dry bilaterally, and color is normal for his ethnicity. Next, I'm going to move on to assessing the pupils. So just look at my nose, and I'm going to shine the light in the left eye, the right eye, and then do it again as I look at the opposite eye. The pupils dilated when I took the light away and constricted when I shined it, and that is a normal finding. Next, I'm going to check for accommodation, so I want you to look at my pen light and then look at the further wall. The pupils constricted when he looked at my pen light and dilated as he looked towards the wall. That's a normal finding. So pupils are perla, equal round, reactive to light, and they accommodated. Next, I'm going to inspect the mouth. So do you have any lesions in your mouth?
I hope not.
Okay, so go ahead, open your mouth. Say ah.
Ah.
Yep, stick your tongue out and put the tongue at the roof of your mouth. Okay. The oral mucosa is pink and moist. The uvula rose when he said ah. The tongue is midline and I did not see any lesions present. Everything appears to be normal. Do you have trouble swallowing?
No.
Okay, go ahead and swallow for me. Alright, good job. Go ahead and smile, frown, puff out your cheeks, and close your eyes. Okay, cranial nerves are intact. Can you move your head right and left? Okay, patient has full range of motion in cervical spine. Now go ahead and stand up for me and face your back towards the camera. Okay, so I'm going to palpate your spine. Tell me if you feel any pain. Any pain?
Nope.
Okay. The spine has a normal curvature. Patient reported no tenderness or pain upon palpation. The skin is warm and dry and intact. The color is normal for his ethnicity. And then I would also check the sacral area to ensure that it is blanchable. Okay, you can turn back around. Next, I'm going to inspect the chest and the thorax. So, chest has a normal contour. It's symmetric. I don't see any lesions or pulsations. Everything appears to be normal. Next, I'm going to check skin turgor. Okay. Skin turgor was firm, it was easy to pick up, and there was no tenting. Everything is normal. Moving on to respirations. First, I'm going to start by inspecting him. So his respirations appear to be normal upon inspection. Symmetrical rise and fall of the chest. He appears to be and no respiratory distress. He's not in any abnormal positions such as tripoding. Do you have a cough? No? Okay. Patient reports he has no cough. Next, I'm going to listen to the lungs. Okay, so when you feel my stethoscope on your chest, go ahead and take a deep breath through your mouth, in and out. Breath sounds are clear and equal bilaterally on the anterior chest. Go ahead and turn around for me. Now I'm going to take a listen to the back. Breath sounds are clear and equal bilaterally on the posterior chest. Everything is normal. Okay, you can turn around. Okay, next I'm going to listen to the heart. So I'm going to start by listening to the aortic valve. This is the second intercostal space just right of the sternum. S1 and 2 identified, no other heart sounds heard. Now this is the pulmonic valve, second intercostal space, just left of the sternum. S1 and 2 identified, no other heart sounds. Now I'm going to listen to the aortic valve. This is the fourth intercostal space, just like a little bit under the pulmonic valve. S1 and 2 identified, no extra heart sounds. Now the mitral valve, fifth intercostal space, mid-clavicular line. S1 and 2 identified, no extra heart sounds. Now I'm going to take an apical pulse. So I have to listen for a full minute. Apical pulse rate was 78 and regular. Okay, next I'm going to move on to the upper extremities. So I'm looking at the upper extremities. I'm looking for any lesions or edema, which I don't see. I'm checking the temperature of the skin. It's warm and dry bilaterally, and color is normal for his ethnicity. Can you move your arms? Okay, patient has no trouble moving arms. Okay, go ahead and squeeze my fingers. And try not to let me go. Okay, grip strength is strong and equal bilaterally. I'd grade it a +5. I'm going to go ahead and check his radial pulse. Okay, radial pulse is regular and equal bilaterally, and I'd grade it a +2. All right, let me see your fingers. Okay. The nail beds are firm. And I don't see any clubbing, so that would indicate that he has no long-standing hypoxia. Checking capillary refill, it's brisk, less than 3 seconds. Everything appears to be normal. Next, I'm going to move on to the abdomen. So I'll start by asking you to move to the bed. Okay, so I'm going to start by inspecting the abdomen. I'm looking at the contour of the abdomen, which appears to be normal. I don't see any distension or pulsating masses. So I have a few questions for you. When was your last bowel movement?
About 8 o'clock this morning.
And was it normal?
Yeah. Yeah, it was pretty normal.
Okay, was there any blood in the stool?
Just some corn.
Okay, perfect. When was the last time you urinated?
An hour ago?
Okay, was there any burning?
Nope.
Okay. What was the color of your urine?
Crystal clear.
Okay, and was there any odor?
Nope.
And what was the amount, like your usual amount?
About a bottle and a half full.
Okay, so patient reports normal elimination habits, nothing out of the ordinary. Okay, I'm going to go ahead and take a listen.
Okay.
I'm going to start in the right lower quadrant. Bowel sounds are normoactive in all 4 quadrants. Next, I'm going to palpate the stomach, so I want you to tell me if you feel any tenderness.
All right. Nope.
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 Patient reports no tenderness or pain upon palpation, and he wasn't guarding, and I didn't feel any masses. All right, you can go ahead and sit back in the chair. Can they see your legs? Maybe sit on the bed. Okay, lastly, I'm going to the lower extremities. Okay, so I'm looking at the lower extremities for any lesions or edema. I don't see any edema or any lesions. I'm feeling the temperature. Skin is warm and dry bilaterally. Can you move your legs? Okay, good. Patient has no trouble moving legs. Can you push up?
Like that?
Yeah. And lift your feet up and push down. Okay. Patient strength was strong and equal bilaterally. I'd grade it a +5. Now I'm going to check pedal pulse. Pulse is regular and equal bilaterally. I grade it a +2. Now I'm going to check capillary refill. Capillary refill is brisk, less than 3 seconds, and the nail beds are firm. And that is the end of my head-to-toe assessment.
I'm healthy.